to the presentation. Yes. Yes. Okay. So welcome. Presentation is called Food, Your Body, and You. This is a pretty general introduction to fat phobia and diet culture. Who am I? My name is Haley Jones. I use they, them pronouns. I'm a therapist in the Portland area. I also worked at Campus Rec for, I think, 6 years, my whole undergrad and my whole master's degree in counseling. I taught group X classes and I was a lifeguard and did some of these presentations and really loved it there. So I'm happy to be back. My identities are that I'm white, I'm queer, I'm trans and non-binary, I'm neurodivergent, more specifically, I'm autistic, I'm disabled, I'm currently in a smaller body, lower income, US born documented, and I am an LPC intern, so I have my master's degree. I primarily specialize and work with people dealing with eating disorders. More specifically, I work with a lot of trans and non-binary people dealing with eating disorders, body dysmorphia, gender dysphoria, any sort of exercise addiction, or really anybody that just wants to work on their relationship to food, their body, and movement. I put my email address there in case anybody wants to contact me at a later point. And I also put my Instagram, which is the Queer Counselor. You can feel free to check that out for a ton more resources. And yeah, I just like to share my identity so you know where I'm coming from. I hold both privileged and oppressed identities, and that shapes how I show up in the world. This presentation, all things in life, how I'm treated, etc. Starting off with a land acknowledgement, we are currently on Chinook land. There's a link if you want to find out what native land you are on below. And then another important thing is that land acknowledgements without action are pretty much pointless based on the research I've done from Indigenous folks. So I like to invite people to see if you can take a step further than that, if you can donate money to Indigenous tribes near you or that you are on, or really take some time to think about the questions on the far right, such as your relationship with Indigenous peoples and non-human beings with the land and water that you are on or near. And then throughout this presentation, I just like to invite people to notice what comes up for you. This can bring up a lot of hard feelings, a lot of strong reactions. Just notice those, try to not judge those feelings. Topics of fat phobia and eating disorders often bring up a lot for folks. They can be really sensitive topics. Some of the information might make you angry or pissed off. You might think it's not true. If that comes up, just notice that, sit with that. Usually that's a sign to go into those areas more, explore them more with a therapist or friends or follow people on the internet, that sort of thing. So just an invitation for everyone. And also if anyone at any point needs to leave, feel free to turn off your camera. If something becomes too triggering, you do not have to stay. I will not be offended, and I want you to take care of yourself. So, start with a quote I really like from Sonia Renee Taylor. She's the author of the book, The Body's Not an Apology. I highly recommend it. It's one of my most favorite books, full of really good prompts. But the quote is, every time you interrogate the beliefs and biases you have about other bodies, you interrupt the systems that profit off the way you feel about other bodies and the systems of comparison we live in. My takeaway from that is the bodies are very political. There's no way for them not to be. And when we interrogate and look at our own beliefs and biases, we can interrupt larger systems at play like capitalism and white supremacy and other systems of oppression that harm us. Throughout this presentation and just a recommendation for folks going forward, I will be using trauma-informed language in regards to body size. I won't be using the words overweight, underweight, or obese. All of those are considered medical slurs by fat communities. Instead, I recommend using the language that individuals or communities ask you to use above all else. If you don't know, ask someone. Learn from those with lived experience. Example, follow fat activists on social media. Find out what they want you to be using. And if you don't know, I default to person in a larger body or person in a smaller body. The reason overweight and underweight are terms that we shouldn't really be using anymore is because they imply that there's a set healthy weight that you can be under or over, and that's just not true. There's no set point where someone becomes suddenly unhealthy or has health issues or should be called those words. And the Latin roots of the word obese mean to eat away or to eat all over the place, which implies that someone who is fat eats a certain amount of food or eats more, which is simply, it's not true. It's not supported by science. So moving away from those words. We are going to watch a short clip from this YouTube video, if it works. This is Sonia Renee Taylor, a really great TED Talk. Let's make that back. Okay. We're gonna watch like 3 minutes of this.
We can't hear it, or I can't.
Sound isn't working. Captions. What about now?
No.
Well,
Haley,
okay.
I would say maybe you can stop share and share again, and there's an option in the bottom left to share computer audio. That might be what you need to check for us to be able to hear it.
Okay. Oh, I got it. There you go. Worst case scenario, I planned for this and we can skip it and people can watch it later. Okay, we'll try one more time.
Of political warfare. So, welcome, revolutionaries. Good evening. For many of us, we grew up believing that political activism meant a very specific thing, that it meant this, right? Or that it meant this. Or, in its most extreme cases, that it meant this. But what if I told you that political activism isn't actually a choice, that being political isn't a choice? What if I told you that political activism is this? Sikh model Haroon Carr unapologetically rocking a beard. What if I told you it's Stella Young doing a TED Talk on how she is not your inspiration porn? What if I told you that it was 50, 100 Black men graduating from college? The truth is, our bodies are political. The personal is political, whether we want it to be or not. So the really only question to be pondered is whether or not we will use our bodies to uphold systems of oppression or to defy them. The word body positive is quite a buzzword these days. Everybody's saying it, right? It's very cute. Normally, it conjures notions of spa days and rocking your favorite pink bikini, defying the sin of cellulite. And while body love is an amazing thing to aspire to, unto itself, it will not change the world. I hate to be the bearer of bad news, but your hot pink bikini and your new Italian Speedo are not disrupting any systems. However, there are ways to use our bodies as everyday acts of resistance. I call this work radical self-love. Radical self-love moves us beyond the flimsy notions of self-esteem or self-confidence. It moves us beyond the notions of individualism. Radical self-love is not independent, it is interdependent. It is about our relationship not only with our bodies, with the bodies of others. As we learn to make peace with our bodies and make peace with other people's bodies, we create an opening for creating a more just and equitable world. Every time you call truce with your body, you interrupt a system of violence and power that profits off of your self-hate. Every time you interrogate the beliefs and biases that you have about other bodies, you interrupt a system that profits off of the way that you feel about other bodies and the systems of comparison that we live in. Our relationship with our bodies is our access to a more just and equitable world. Our relationship with other people's bodies is how we bend the box towards justice.
All right, I'm gonna pause
This
there. And let me reshare back to the other thing. Okay. And you can still hear me, right? Yeah, okay. Highly recommend watching that whole talk. Sonia Renee Taylor is amazing, and her book also goes much deeper into these topics. So I like to share that just to set the stage that this is going to be a political presentation. Social justice will be centered. Our bodies are political, and there's no way to get around that. They just are. And not only our bodies, but how we relate to other people's bodies as well, and greater systems at large. Quote just from her talk we just listened to: our bodies are political. The personal is political, whether we want it to be or not. So really the only question to be pondered is whether or not we will use our bodies to uphold systems of oppression or to defy them. Love that. Super powerful. So here's where we're going to kind of get into the meat of things. Starting out with the definition of what is diet culture. First of all, diet culture is really insidious. It's around all of us. It's very common in Western culture. It's really not something that one can avoid. That's probably the hardest part about working with folks dealing with eating disorders, is that they are working to heal in a culture that does not support that. So diet culture is a system of beliefs. It's systemic, it's interpersonal, it's intrapersonal. So it exists on those three levels, and it oppresses anyone who doesn't match up with its supposed picture of health. Its supposed picture of health disproportionately harms women, femmes, trans people, people in larger bodies, people of color, Black people, disabled people, Indigenous people, and this is damaging to mental and physical health. It's also traumatic. Diet culture promotes weight loss as a means of attaining higher status and privilege. And the reality of that is that that is true. That is what thin privilege is. If you are in a smaller body, you do hold privilege that impacts how you move throughout the world. Diet culture worships thinness and equates it to health and moral virtue. So that usually means if you're thin, you are seen as a better person, a more morally superior person, a healthier person, and that has impacts in our lives as well. Diet culture makes a ton of money. Just in the US alone, it's worth $66 billion. Makes a ton of money every year. Thinking about the products that are sold underneath diet culture, that would be anything from like dieting foods to gym memberships to programs like Weight Watchers, all over the place. You can probably think of a whole lot of examples. And diet culture demonizes certain ways of eating while elevating others. So examples of that would just be things like labeling foods healthy versus unhealthy, or there's certain foods that are labeled superfoods or diet foods, or things in like special portion controlled packaging, that sort of things that are seen as better. That's what diet culture is, and there's some examples below. Again, it's very common. It's also a shapeshifter in a lot of ways. I think like in the early 2000s, the word diet was much more common than it is now. What's much more common at this point in time is lifestyle change. The word diet has become a lot less popular over time, or it's seen as bad in a lot of ways. So that's really changed, even though the products and the things being sold are exactly the same. It's got a different label. Now I'm going kind of back into history, the connections between colonialism and diet culture. So food was a principal tool of colonization. In Europe, food played a really big role in religious affiliation and social class. And Europeans believed that specific foods made up the colonial body. If you want to go into way more detail on that, there's a link to an article. If you click colonial body, it's very interesting. So a lot of it has to do with Christianity, but Europeans associated indulgence, and they viewed that as being sinful. So if it tastes good, it is really bad for your body and your soul, and it's considered a sin. So when they came to this country and committed genocide, they brought these beliefs over about food and spread them all about. For way more information on the topics of pain, colonialism, historical trauma, and eating disorders, I highly recommend checking out Gloria Lucas. She has a really great presentation that's like an hour and a half long. You can listen to the recording or stuff on her Instagram about the connections between these three topics that I cannot recommend enough. She's an Indigenous woman and really appreciate her work. And this is a quote from the book Fearing the Black Body, The Racial Origins of Fatphobia by Sabrina String. Also highly recommend that book for reading, which makes sense. She's also on the podcast episode that I put below where she summarizes her findings. But she talks a lot about how fatphobia comes from white supremacy, and that's really the roots of it. Her quote is that by the middle of the 18th century, because of the fact that the main mechanism from separating free from slave, which had been skin color, was no longer effective, they started to identify new traits of inferior and superior people. And the conclusion that they came to was that inferior races have no self-control, and lack of self-control they associated with being in a larger body because they associated with eating more. So that was like the beginning of this linking up between what was considered an unruly type of fatness to blackness. And again, highly recommend the book to go way deeper into that topic because it really goes far back. And that is really the root of everything we are talking about today is white supremacy. Here's some more resources on those connections between white supremacy, diet culture, and eating disorders. Alicia McCullough has some really great presentations. If you want to follow a dietitian, Jessica Wilson is great. And then Caleb Luna talk a lot about the history and how this continues on today. Next definition, fatmesia. This is also called fatphobia or sizeism. Folks are moving away from the word fatphobia at this point because the connotations of phobia is that it's a fear, and the mesia addition to the word means it's more about hate. It's not, if you're not afraid, you are actively oppressing folks. So I will probably flip-flop between the two. Sizeism is also an appropriate word to use. They're all the same thing, but again, working to move away from fatphobia. Fatmesia is prejudice plus power. The power piece is really important, and that often gets left out in conversations. And the important piece there is that fatmesia has institutional power. So thin people have institutional power where fat folks, and it's on a spectrum, do not. Just one example of this is medical fat phobia. So fat folks face that, and that has a lot of real life impacts, including even death. So like symptoms being ignored, getting wrong diagnoses, that sort of thing. Another example, difficulty finding clothes or inability to find clothes in the store, or being forced to buy 2 seats on a plane, which costs way more money. So yeah, it's prejudice plus power. The power piece is really important because it's the institutional piece, but it's also the prejudice, so hatred or mistreatment of fat people, people in larger bodies. Oops. So fatmesia also stems from 3 incorrect cultural assumptions, and these are the assumptions that often bring up a lot for people. So if you notice yourself being like, oh, this isn't true, I don't believe this, just see if you can sit with that. When I first learned these things years ago, I was like, what? This is not what I learn everywhere. This is not the messaging from the greater culture. So it can be kind of jarring. First misconception is that there is a right or a normal body type, and that body type is thin, that body type is white, that person is cisgender, that person is straight, able-bodied, and young, and that is seen as a normal body or the body type we should all strive to have. Which is not the case. People exist in all body sizes. Fat people exist, thin people exist. Not everyone is meant to be thin. We're not all thin people. Number 2 is that there is a correlation between thinness and physical health, and that health is an indicator of value. So there's two pieces to this. The first one is the correlation between thinness and physical health. A lot of people assume that if someone is thin, they are physically healthy, and if they're fat, they're physically unhealthy. There's a lot of science to back up that that is not true. You can be healthy and be in a thin body, or be healthy and be in a fat body. If that is shocking to you or you don't believe that, highly recommend just checking out some of the research that's linked within the presentation. And then what I find to be the even bigger piece of that is that health is not an indicator of value. No one owes you to be healthy. Some people will never be healthy. Some people are disabled. Some people are chronically ill. And that doesn't mean they are not worthy of respect, love, care, to be treated well. So to me, that's the bigger piece, is that no one owes you health. And just because someone isn't healthy doesn't mean they deserve to be oppressed or treated poorly. And then number 3 really ties into number 2, but is that fatness or fat body type is abnormal, and therefore is a health risk or a social disadvantage. And again, that ties in with both of them. It's normal to be fat. Some people are fat, some people are thin. It's the same as height. Some people are short, some people are tall. There's variation in how humans look, and that is normal, to be expected. It exists in all of the animal kingdom. It's just how it is. And again, if you're like, what, I don't buy that, definitely check out some of the articles, read some of the research. This guide on the bottom is really great too, from Simmons University. So fat phobia or fatmesia exists in 3 layers. This is from a really great article by Birgit Tovar. The link is here if you want to go into more detail. But it exists on an intrapersonal, interpersonal, and institutional level. Most people tend to focus on level 1, the intrapersonal, and then they miss the second 2, which are critically important, and it's the power piece of the prejudice plus power. Start with the first one. Interpersonal fat phobia is just how we see ourselves. It impacts our relationship to food, our relationship to our body, and our relationship to movement, how we see ourselves in our body. This interpersonal level is where eating disorders can come to exist, or disordered relationships with food and exercise. It's everything that happens in our own personal experience. Number 2 is interpersonal, and that's how other individuals treat and see you. That's where things like thin privilege can come in. So like me, I'm in a relatively smaller body. People do not make comments to me that I should lose weight or that I should eat differently. I could go out in public and eat a big piece of cake and nobody would say rude things to me, where if I was in a larger body, I would very likely get those sorts of comments, or comments on my weight, or that I should do things differently. So this is how we interact with one another on an interpersonal level. And then the third one is institutional. So that is things like medical fat phobia, access to quality medical care. Another huge one is the ability to see yourself in the culture at large. So like in movies and literature, if you think about who do you see in the media, it's primarily thin people. And if you want to get more specific than that, it's thin, white, cisgender, straight, able-bodied young people. So not seeing yourself in the culture at large, it does have a big impact on, going back to the intrapersonal, how we feel about our own bodies, and then in turn, how we treat the other bodies that we see, people around us. So yes, 3 layers, all critically important. What are the impacts of these things, of fatmesia and diet culture? Kind of touched on these a little bit already, but on the interpersonal level, again, it's widespread eating disorders, disordered eating, body shame, disordered relationship with exercise and food, self-hatred. I think we'll talk about this later in the presentation, but there was a research study in 2008 that found that 75% of women endorse disordered behaviors in regards to food and their body and exercise. So disordered relationships to food are more common than they are not. I know many people with disordered relationships to food. You probably do too. Again, it's like diet culture is really insidious. You might not even realize you know that many people because it might be things that you see as normal, like, oh, everyone just does this, everyone restricts food or feels guilty about food, that sort of thing. The impacts on the interpersonal level are things like oppressive and harmful comments about someone's body size, what they eat, how they do or do not move their body, personal rejection due to body size. A common example of that is a lot of people say they have a dating preference for thin people and don't go any further to interrogate how that is fat phobia. So that's how that shapes up on the interpersonal level. And then we've already talked about, the institutional quite a bit, but just a few other examples of that are like employment discrimination is very common and highly researched. That folks are less likely to get hired for a job than a thin person with the exact same qualifications and the exact same resume. Policies, like making folks in larger bodies buy 2 seats in airplanes, things like that. And medical fat phobia, which is really a really big one. And there's some research on there if you want to learn more about that, you can click the link. Implicit bias is something that we all have. I highly recommend you take this Harvard implicit bias test for body size specifically. We live in a culture that sends us the message that thin bodies are better, and they are the bodies we should all strive to have. They are what are beautiful. And even if we don't want to, I guess, sit with that truth, it is true that we all internalize that, and those preferences end up becoming our preferences. Not that that's impossible to unlearn. In my opinion, that is a journey, a lifelong journey of unlearning fat phobia. But if we don't engage in that work, we will have a preference for thin bodies pretty much all the time if you are from a Western culture. This doesn't mean you are a bad person or have done something terribly wrong. The water we swim in is fat phobia. It's all around us. It's not possible to not internalize that if you are living in a Western culture. It's everywhere, and it's very insidious. So if that doesn't feel true to you, I just recommend taking the implicit bias test and just seeing what you get. Most of us will have a preference for thin bodies, unless you have done a lot of work of unlearning, which again is really, really a lifelong process. You can also do it for other things too. It's very enlightening. So who are the most common sources of fat media? Physicians and family members top that list. So among family members, things like weight-based teasing and diet talk are linked to a whole host of struggles currently. So things like binge eating, weight gain, extreme weight control behaviors, diet, that sort of thing. It also can be really traumatic. That's a lot of the clients I work with on like a therapy basis have had family members who maybe put them on a diet when they were young, or teased them about their weight, or told them they needed to lose weight. And that can really, really impact our relationship to food and our body. And it can stay that way for our whole lives. Not always, but it can have really, really painful impacts. An example of what healthcare providers might do when talking to patients in larger bodies include very often providing them with less health information, often spending less time with them, often viewing them as undisciplined, annoying, or non-compliant with treatment. And another really common one is diagnosing them with higher levels of pathology. And that's more common in like psychiatry, counseling worlds. But again, these are all institutional examples of fat media, and they have real life impacts. And they can harm people, they can kill people. I mean, if you're not getting time spent with you, if you are not getting the health information you need about the problem you're having, or a common one is just being told to lose weight. If you come in with like stomach pain or heart pain or something, could be anything, when it's actually something that needs to be checked out. This is an institutional example of how that shows up. Some more impacts, noticing the time. Again, I said this before, but 75% of women endorse the sort of thoughts, behaviors, and feelings related to food in their bodies. So I like to share that just to highlight how common it is to have a disordered relationship with food, your body, and movement. It is more common than not. And I wouldn't be surprised if that number was up from 2008. That's kind of old. But yeah, it's really common. And it's common for men too. This is not just women. And for people of color, Black folks, Indigenous people, trans, queer, non-binary people, people who are incarcerated, disabled folks, low-income communities, refugees and survivors of war, and youth in foster care and houseless people, eating disorder rates and disordered eating rates are even higher, which it makes sense when connecting it back to Sojourner Nay Taylor's talk in White Supremacy and Colonialism. All those identities are oppressed identities, and that can show up as a eating disorder or disordered relationship with food for a whole lot of reasons. And a lot of times where issues arise, usually when people think of eating disorders, they think of a thin, white, cisgender, straight, usually college-aged woman. And those people with those identities do deal with eating disorders, but that usually becomes the whole narrative, and people with other identities are often then left out. They're not given treatment, their symptoms are taken less seriously, and that can end up causing a lot of harm. Following that, an example is that trans people are at a 4 times greater risk for developing an eating disorder than cisgender individuals. So that's a lot higher. I mean, that's a really high rate. And if you think about common eating disorder narratives in the culture, I can't think of any that are about trans people. I'm trying to think. Yeah, I can't think of any, but the rate is that much higher. And who would know unless you're trans? Like, this was me. I am in recovery from an eating disorder, but I didn't know that at the time, and I didn't see myself represented anywhere. Another one is that Black teenagers are 50% more likely than white teenagers to deal with bulimia. So that includes binging and purging. Again, I can't think of many representations of Black teenagers with eating disorders in the media. So these symptoms often go unignored, undiagnosed, and then you're not getting the help that you might need. Biggest thing from all this information is that fatphobia, fatmesia is and can be traumatic. It can cause a lot of harm. It can cause more so than eating disorders. It can change the way that we think about ourselves, the world, and other people. It can change a lot of things and make us really struggle. And it's a totally valid trauma, and it's not one that a lot of people recognize as a trauma, but it's very real. So now we're going to go into just some common weight and health myths. This section is probably the one that's most likely to bring up things that are difficult to hear, or you're like, what, this isn't true. So just notice what comes up for you. Notice any resistance or irritation, and explore that, sit with that, read some more of the information that comes up if you want to know more, or if you think it doesn't seem true. So probably the biggest one is that 95% of diets or intentional weight loss attempts do not result in long-term weight loss. This has been proven by a whole lot of studies. There was a 29 study meta-analysis, which means they looked at 29 separate studies, and they found that in structured weight loss attempts, the vast majority of participants regain the majority of weight loss after the 5-year mark. So there are a lot of weight loss studies that show weight loss as being effective, but they stop before the 5-year mark. So a lot of them will be like a 6-month study or a 2-year study or a 3-year study, and they'll be like, look, weight loss is effective. But once you pass that 5-year mark, most people, 95% of people, regain the majority of the weight they lost, and many people actually gain more weight back than once was lost, which is called yo-yo dieting. Another big one that's really concerning is that 1 in 4 diets do progress to an eating disorder, 25% of them. This is most of the clients I work with. They started a diet, they wanted to try that out, they wanted to lose weight, and then it progressed to an eating disorder. And unfortunately, that's not uncommon. It's fairly common. The other big one is that there's this very widely held belief that the larger your body size, the less healthy you are, and that is just not true. Science does not support that. I'm not going to use this word in any other point, but individuals in the quote unquote overweight category do have the lowest mortality rates of any of the weight categories, disproving that myth that higher body weight equals poor health. And then when we go down to the next one, it's a little bit about weight cycling. So weight cycling is what happens when you diet and then you lose weight and then gain it back, that kind of going up and down in your body size. That's where a lot of the health problems actually do come in. So going up and down in your weight like that is linked to higher mortality, osteoporotic fractures, gallstone attacks, loss of muscle tissue, high blood pressure, chronic inflammation, and even cancer. So that's really where a lot of the health risks come in, is that going up and down, engaging in diets, coming off of it, doing it again, going up and down and like that. And these two research articles, Tilka 2014 and Bacon and Aftermore 2011, are my two favorite research articles from this presentation. That if you want more info on the science of weight cycling and body weight and health, I highly recommend reading those. They're fairly accessible and I would say easier to read than some other scientific articles I've read in the past. Also, this YouTube video that we're not going to watch now, but it's called Poodle Science, and it goes over some of these points in a cute little video about dogs. It's only like 2 minutes long. Also recommend watching that. But some more myths or tips that can be really helpful to follow or to know is that people of any size can have any of the eating disorders. Just one example, the majority of people with anorexia are not in emaciated or very thin bodies. That is a stereotype that's perpetuated by the media that is largely false and causes a lot of people to not get help. I think the number is 80% of folks with anorexia are not in a very thin body. So it is the majority. Most people with anorexia are not very, very thin. Again, I've said this already, but eating disorders disproportionately impact people of color, Black people, Indigenous people, trans people, disabled people, and anyone with oppressed identities. This feels important just to say because I feel like the media mostly shows white, thin, cisgender, straight women as folks dealing with eating disorders, and usually they are dealing with anorexia and in a very thin body, which again, there are people that fit those identities and that diagnosis, and they are totally valid and real, but that is not the majority of people with eating disorders. Some other things that you can do now is please do not congratulate or encourage behaviors in people in larger bodies that you would diagnose as an eating disorder in people in smaller bodies. That's very, very common. Things like food restriction are really, they're encouraged to most of us, but especially to people in larger bodies, and when I would be working with a client with an eating disorder, that would be something that's like a diagnosable eating disorder. So something to think about. The most common eating disorder in the US is binge eating disorder. That also feels like something that most people don't know and isn't widely talked about. The appropriate intervention for binge eating disorder is not weight loss. That's a whole other topic, but something to know. Food and sugar addiction, those are big topics. I highly recommend reading the research that is linked next to those, but those things are both not supported by evidence, which is not to say one can't feel addicted to food or to sugar, but they are not actually physically addictive things, since we need food to live, and all food does break down into glucose, which is sugar. But the feeling of being addicted to food is a very, very real thing that usually stems from restriction. So yeah, highly recommend checking out those research articles. So those determinants of health, what we eat, how much or little we move, and other lifestyle choices we make account for less than 10% of our health. What really impacts our health are things like discrimination, oppression, stigma. If we have a job, if we can make enough money to feed ourselves and survive and have housing, access to healthcare. A huge one is if we have a history of trauma or abuse. Social connectivity. So do we feel like we have a community? Do we feel like we have support for people to turn to? And then stress from school, from jobs, wherever it might be coming from, that also has a huge impact on our health. So this one feels just like an important one to share, because I feel like most people assume that what we eat or how much or little we move, or it's like the personal choices we make have a much larger impact on our health than they actually do. If you want to go into way more detail on this, there's a link here to this book called Anti-Diet by Christy Harrison, and she has lots of research about this. Very, very good. Healthism. Healthism is a very common thing. Essentially, it's this idea and this like preoccupation with personal health as like a definition of achievement or moral value. Kind of touched on this earlier, but it's like that idea that we are personally responsible for our health. And if we don't engage in these health-seeking behaviors that other people have defined, then we are a bad person or lazy. Something's wrong with us. We deserve to be treated poorly, that sort of thing. And the issue with this is a lot of things, but it ignores the social determinants of health that we talked about in the previous slide. So things like poverty, oppression, war, violence, abuse, the environment, all these other things that actually have a far greater impact on our health than the personal choices we make. I put a bunch of recommended readings about this on the right side that I recommend checking out. That podcast is especially good, Healthism and Fatphobia with Hillary Kanabe. Probably the most important thing, honestly, about this is that, again, people don't owe you health. If someone's not healthy, that's fine. That is not a reason to oppress them. So highlighting that. This is an example of kind of what I talked about earlier, how these behaviors that are exactly the same are applauded or even prescribed or recommended to people in larger bodies when they are diagnosed as eating disorders in people in smaller bodies. And the reality is they should be diagnosed by any body size as an eating disorder. So that could be things like tracking every bit of food you eat, weighing yourself every day, exercising to compensate for what you ate, or restricting whole food groups. And just as an asterisk, that does not mean food you restrict for medical reasons or allergies, but for other reasons. I really like that graphic. I think it makes an important point and highlights that issue that really happens very often in our culture. We already talked about that, but again, important to remember, 1 in 4 diets will result in an eating disorder. Honestly, it's probably more common than that, but that's the current research that's out. Moving into some healing frameworks. So now that you know this information, it's like, okay, what's next? Is there any frameworks for working on my relationship to food, body, movement? So here are 4 that I really like. I mean, these are honestly probably the main ones. Radical Self-Love by Sonia Renee Taylor. She has a book out. Highly recommend that. Body Trust by Be Nourished is a framework that I'm trained in. I'm a certified body trust provider. Be Nourished has a lot of really great workshops that you can actually take with other people that are working on unlearning and learning a lot of the same things. Really recommend. Intuitive Eating is a book if you want to get more specific about your relationship to food and what you eat and what you don't eat, that sort of thing. I put a link to that there. And then Health at Every Size and Body Respect by Lindo Bacon and Lucy Ashenmore. If you're kind of looking more for like the science of health at every size or weight and that sort of thing, those 2 books at the bottom are probably where you would want to go. For time's sake, I'm going to kind of go quickly over a few of these, but here's the Health at Every Size components. Essentially, Health at Every Size celebrates that we all come in different shapes and sizes. We're all different races, ages, ethnicities, genders, that sort of thing. We have different identities. Health at Every Size challenges a lot of the scientific and cultural assumptions that are very present in Western culture related to weight, body size, and health. Values body knowledge and lived experience, and compassionate self-care is a big part of it as well. I really recommend this book. It's really good, and some of the research articles that are linked in those little X's as well. Health at Every Size is probably what will dispel a lot of the myths you have, again, that are more like scientifically based around body size. So if that's your thing, that's where I would go. And then Intuitive Eating is a lot more about like your very specific relationship with food and how you relate to it, what you eat on a daily basis. So if you're looking for more structure in that sense, read the intuitive eating book, take this intuitive eating scale quiz, just to get like some insight into your current relationship with food, again, because diet culture is really insidious and you might not even know you have a disordered relationship with food, or even an eating disorder. That's actually more common than one might think. Some tips. My biggest tip is, if you can, to work with a fat positive, health at every size, intuitive eating informed dietitian or therapist or coach. You don't need to have a diagnosable eating disorder to work on your relationship to food, your body, and movement. Going back to that statistic that 75% of women have a disordered relationship with food, body, movement. This is like a widespread problem. Most of us could spend some time working on our relationship to food, body, and movement and benefit from that. I put my email at the end of this presentation, and if anybody needs any help finding someone who fits those criteria, I'm more than happy to. There are a lot of dietitians, therapists, and coaches out there who are not informed in these topics and can cause harm. That's not uncommon. So those are some of like the buzzwords to look out for in like a therapist or a dietitian's profile, if you're wanting somebody that's working from this framework. Another one that's like really easy is that exposure to bodies that fit that like thin and beautiful ideal actually increase body shame. So by following a diverse range of people on social media, that's one easy way to reduce your own personal levels of body shame. Of course, it's not going to be a quick fix, but yeah, follow people that are fat, follow people that are trans and queer and disabled and Black and Indigenous and brown and that don't look like you or that are not traditionally represented in our media. And that can be really helpful, and you can learn a lot as well. Big one, again, you can do this with a therapist or on your own, but just like noticing the ways in which diet culture and fat phobia impact your own relationship to food, your body, and movement. For most of us, it's going to have an impact. It might be big, it might be small, it might be something you never thought about before, never even noticed, but it's insidious, and I'm sure it's going to have some impacts on most of us here. A good place to start with that is the podcast Food Psych with Christy Harrison. It's free. You can find like the basics of health at every size and intuitive eating on that podcast. Highly recommend it. It's very good. There's a ton of episodes. And also Christy Harrison has a great book as well. And probably the biggest one is notice the ways in which you have and continue to perpetuate that phobia, fatmesia, and diet culture. Again, the implicit bias thing, we all have it. It's the culture, if you grew up in Western culture that you have been surrounded by most of your life and continue to be currently, it's not possible for the most part to internalize some of those messages. And a lot of us have perpetuated fat phobia and diet culture. I know I have for sure in the past. It's something I'm still working on and learning. But it's something to be aware of, and that is in a lot of ways where the political piece comes in. Oops. Here's a whole list of accounts to follow. This is just a few that I really like. A lot of fat activists, a lot of dietitians on this list, a lot of people with oppressed identities that are doing eating disorder work, fat positive work, liberation work, anti-racism work, and all of those things intertwined. Again, I put a link to the presentation so you can go and follow these people. These people are all on Instagram, but a lot of them are also on TikTok and Twitter as well if you have other accounts. But yeah, if you want more information on any of these topics, a lot of these people have a whole lot of stuff out there that you can learn from that is really helpful. And then finally, here are some more resources. What do I have here? The biggest one is a huge Google Doc full of resources. This is like a lot of pages of people to follow, books to read, podcasts to listen to. There's a lot of research articles in that document if you are more interested in that. Yeah, then there's some writing prompts for fat phobia and weight stigma if that's something that you want to explore more in yourself. And then I also put my contact information, my email. Truly, if you have any questions or if you want help finding a provider of some sort that works from these frameworks, feel free to email me. My have a whole list of people that I can send out with SelfLove. And yeah, that is the end. And I'm gonna stop sharing. I have until 2:05, so if there's any questions, I'm happy to answer. And thank you all for listening.